We're here to talk about your partial knee replacement. Could you just run me through your background in terms of work and your leisure activities you enjoy?
Well, before the operation, I was working as a judge. I've been a judge now for 9 years. Of course, before that, I was at the bar, so very active and moving around a lot. But once I became a judge, a very sedentary job, which meant that actually I did feel that my knee started to get worse because, of course, I was still all the time. And sometimes I found it quite difficult if I was sitting for several hours at a time. Actually standing up and having to move again was quite difficult. I'm pretty active. I play golf, very keen on sailing, cycling, running, things like that. Running, of course, became something that I was unable to do after a while.
We were concerned at that stage you were very young for joint replacement.
Yes.
And we needed to try and try all other options in order to delay the need for joint replacement.
Indeed.
So about 3 years ago, you came back to me.
I did.
With increasing problems in the knee at a stage when I think it was starting to affect your quality of life.
I got to the stage where I couldn't get around the boat properly when I was sailing, which meant I was having to stop sailing. With my golf, I was playing golf, taking painkillers for my knee, but one of the big problems was that I was starting to get problems with my left foot.
Your problems are very classical for patients moving towards joint replacement. In fact, golfers are some of the easiest patients we treat in terms of deciding when to have their surgery. Whilst they're still able to get around the golf course once or twice a week, albeit with discomfort and maybe with some painkillers, then we think it's too soon. But when it starts to affect you so that you cut your round short and maybe you avoid playing, then that's probably the ideal time for surgery. Was that the case with you?
It was. I mean, there was certainly that, and as I say, there was the problem with my left foot, which was stopping from playing golf, which I was convinced was to do with the fact that I wasn't walking properly. And one of the things I found, actually, there was a lot of times when people said to me, "Why are you limping?" And I wasn't even aware of it. But obviously there was some impact going on in my knee, which meant that I wasn't walking as I should be doing.
Sally, tell me about your experience in hospital when you had your surgery.
When I came in, I'd assumed that I was going to have a general anaesthetic. And I spoke to the anaesthetist and he suggested I should have a spinal anaesthetic. And I have to say I was a bit resistant to that because I was worried about the effect it was going to have. What it meant was that I was completely knocked out during the operation. I knew nothing whatsoever about it. And afterwards it meant that I was on a drip, which meant that I could control my own pain relief. And that lasted for about the next 36 hours. And that was marvellous.
It took about 6 weeks for you to return to golf.
Yes.
And I remember you coming to see me at 6 weeks saying that you'd already played 18 holes, which is actually pretty quick following a joint replacement. They then take a few months for the swelling to go down and
Yes.
to settle fully. How is the knee now?
Well, I've just come back from a skiing holiday with my children. I'm wearing high-heeled shoes again. I dance, I do any of the activities I want to do. I don't have any restrictions.
Do you have any pain still?
No, none.